Hello, licensed agents. This training video provides a comprehensive guide on the process of generating new applications within HealthSherpa for clients. It specifically targets clients whose income levels are sufficiently low, thereby qualifying them for a special enrollment period. You can create a new application in both the open enrollment and special enrollment periods. Creating a new application in the open enrollment period is different than in special enrollment period. The open enrollment period is typically November 1st through January 15th, but can vary in select states. During the open enrollment period, all legal citizens and residents can apply for coverage. In the special enrollment period, which is typically all year round, clients can only enroll in health coverage if they meet one of the special enrollment period qualifications. These special enrollment plans will be effective the first of the following month that the application was enrolled in. You can only create a new application if there are no existing applications set up for the client. Let's look at an example of a client who has low income. His name is John Smith. He was born on October 14, 1989. He is a U.S. citizen. He lives in Georgia, and his zip code is 30022. This application only consists of him. His income is $18,000 annually before taxes. He doesn't smoke. He is not incarcerated. He doesn't have any disabilities. He wants to see if he qualifies for tax subsidies. Log into your HealthSherpa account and use Search Marketplace to check if there is any existing application that has this person before creating a new application. If there is an existing application, you will process that application instead. The client should not have duplicated applications consisting of health insurances covering the same months. This will result in multiple Form 1095-A that can potentially complicate the client's tax returns. Let's get back to John Smith's case. You will use his name, date of birth, state, and social security number to check if there is any existing application. Apparently, there is no existing application consists of John in the marketplace system, so you need to create a new application for him. Click on the green tab, Create a new application. Before processing the application, make sure that the client has given you consent to use his private information for the application, and you need to maintain this proof of consent in an acceptable format. You will not enter the Social Security number here. You will enter it in the Members section. Enter the physical address and other contact details, such as phone number and email. After you finish filling out the information, click on the blue button, Continue, to move to the next section. He wants to apply for tax subsidies to reduce his plan's monthly premium. He is not married, and he files tax by himself. He doesn't live with anyone else under 19. You can now enter the Social Security number here. He doesn't smoke tobacco, and he is a U.S. citizen. He is self-employed. When you select the option, Self-Employment, you can only choose monthly under the header How Often. Because he makes $18,000 annually, you take $18,000 divided by 12 to get his estimated monthly income, which is around $1,500. He doesn't have any deductions. You can skip these questions because they are not related to this case. John is currently not enrolled in health coverage. To qualify for a special enrollment period, the client needs to meet at least one of the special enrollment period qualifications that are listed in this section. But if his income is below or equal to 150% of the federal poverty level, or we can call it FPL, then he is qualified for a special enrollment period. Currently, at this time of the video, the federal poverty level is around $16,000. 150% of $16,000 would be equal to $24,000. His income is below that amount. Therefore, he is qualified for a special enrollment period. You can skip these questions and qualifications. Let's check John's eligibility results. As you can see, he is qualified for special enrollment period due to his income below 150% of the federal poverty level. That's a summary of how to create new applications for people with low income in the special enrollment period.